Good morning, good afternoon. My name is Dr. Zeinab Hijazi. I'm the Senior Mental Health Technical Advisor with UNICEF, based in New York. I'm glad to be here with you today to talk about why and how we need to be prioritizing child, adolescent, and caregiver mental health and psychosocial well-being, utilizing a global lens that bridges program, advocacy, and research. Now, the main message is clear. Children, youth, and caregivers should be a priority for global mental health research, advocacy, and programming. And while we can't have this conversation about prioritizing mental health without acknowledging that we are in a time of COVID, it is important to note that even before COVID-19, children and youth were already carrying the burden of mental health risks, with half of all mental disorders developing before age 15 and 75% by early adulthood, making the case for early intervention before age 15 quite clear. And the risk for mental health conditions and psychosocial problems are often exacerbated in childhood and adolescence, and they are exacerbated especially by poverty, by violence, and disease, or humanitarian crisis. The effects of mental health problems in childhood and adolescence can persist with serious health and socioeconomic implications throughout the life course. Even if we don't have the data to estimate the pandemic's long-term impact on children's mental health, we know from numerous accounts that it's been very challenging. Those accounts include consultations with children and adolescents in 13 countries that UNICEF organized in collaboration with Johns Hopkins University. As you can see from these quotations, many children experienced the pandemic as a very stressful time in their lives. So why does it feel like we are just now starting to talk about and hear about the impacts of the world's many challenges on the mental health and well-being of children? Even though huge stigma and misunderstanding continues to exist around mental health problems, I think there's this feeling that the tectonic plates have started to shift in recent years, and that there's, this growing awareness of mental health problems as a concern. The pandemic may represent as a tipping point that helps draw attention to mental health as an issue. It's raised awareness of mental health and highlighted the fragility of services. And we'd argue that the awareness includes a stronger understanding based on people's own experiences that, the world around us can shape the world in our heads. We'd argue also that the awareness includes a better understanding of the cost of poor mental health. But it's not just COVID. Today we are witnessing increased attention on mental health due to global conversions of conflict, pandemic, natural disaster, climate change, migration and displacement, and political instability, all with heavy implications for mental health and well-being. The impact of the most vulnerable communities and populations, such as those in humanitarian and conflict settings, continuing to be disproportionately high. In addition to the pandemic's shining light on mental health, it remains to be true that every 11 minutes, about one child between ages of 10 and 19 takes their own life somewhere in the world. Suicide is tragically among the top 5 causes of death for young people ages 15 to 19. This puts a shocking point on the call to action on mental health. It is absolutely about saving lives. In a study commissioned by UNICEF, a research team at the London School of Economics analyzed lost human potential arising from mental health conditions and suicide in children and adolescents. Analysis of findings indicates that conservatively, mental health conditions and suicide in children and adolescents cost $387 billion a year in terms of lost human potential. The second response to why now is the global call for action to address the fragility of services and ensure better access, accessible, affordable, and non-stigmatizing mental health services that are available within the community. The shift in understanding around mental health may also include a greater acceptance that people need support and can't just be expected to live through it alone. A Gallup survey carried out for UNICEF shows strong support for this in almost every country, with India being a curious exception. Among those surveyed, the research demonstrated that 83% of 15 to 24-year-olds believed sharing experiences and seeking support is the best way to address mental health concerns. This was found to be as significant with a percentage of 79% in an older age group. Sadly, there's almost no response to those calls for support. Governments in poorest countries spend less than 2 cents for entire populations on treatment, only a fraction of which is diverted to children and families, which means that they spend basically nothing on promotion of mental health for general population and protection of the most vulnerable groups, such as Indigenous and LGBTQI+ kids who have terribly high rates of suicide. The third response to why now is that there is a lot we can do to promote and protect mental health. At the UNICEF Leading Minds Conference in November 2019, Professor Vikram Patel said, "We may not know everything we need to do, but we know enough." This idea frames a lot of UNICEF and partners thinking in terms of responses. We're focusing heavily on interventions that can work to better support parents, to make schools kinder, gentler places, and to use existing community care and social protection mechanisms to deliver mental health support. Now, I'd like to talk about UNICEF's approach to mental health, which embraces a shift from thinking about mental health in biomedical terms, where the focus is on conditions to be diagnosed and medicated, where you either are mentally healthy or mentally ill. Instead, mental health needs to be understood as a continuum. At any stage of our lives, any one of us may find ourselves at different points on that continuum. We're all somewhere on this continuum. Some of us have very good mental health. Some of us have some mental health symptoms. Some of us have a disorder, and some others have a chronic disabling condition. We all move back and forth on this continuum. And so it's important that we move away from the stigmatizing and harmful misconception that some people have a mental disorder and others do not. We need to reprogram our understanding of mental health as a dimension. We need to understand our family, our friends, and ourselves as people somewhere on that spectrum of mental health and meet ourselves and others where they are at. And where you sit on that continuum reflects the interplay of biological and environmental contextual factors, including family, community, sociocultural, economic, political, and legal influences, and the services and structures that surround them, all affecting the development of children through the life course. These factors have been articulated through various frameworks, child development theories, socioecological models, and studies of children's resilience in the face of adversity, all of which emphasize that children, adolescents, and families bring their own skills, their own assets and resources for coping with challenges. The social ecological model illustrates the importance of networks of people and structures that surround a child or adolescent, safeguarding and protecting their well-being and sense of agency, and supporting their optimal development. For children and adolescents, key areas to do this are in parenting, schools, and mental health programming in areas like social protection and community health support. And this is an important focus of UNICEF's work. Parenting and the quality of the relationship between parents and the child is a key determinant of mental health. Attachment here is key. When attachment is positive, responsive, and caring, the child develops a model on which to build sense of self, identity, and a baseline for other relationships. And that affects mental health throughout the child's life. The parent's own mental health is important. Caregiver mental health is a priority for UNICEF, and capacity building here plays a critical role. And for that, we need to, we need tools and resources. In the picture you see here is a mother named Kankai from Sierra Leone, who received support from a community health worker who is also a trained counselor using UNICEF's Caring for Caregiver package. This helps illustrate one of the key solutions for addressing the service gap through training non-specialists to support mental health needs in their communities. Schools are another focus area. Schools can bolster mental health by providing empowering learning and opportunities. They can also be a platform for critical mental health services, but they can also be a risk factor. Places where children and young people are faced with violence, bullying, stress, and abusive learning environments. A theme that came out in workshops we carried out with youth was how negatively perceived schools are for many kids. In Egypt, an older girl said, "The teacher harassed girls, even in primary or preparatory school. He touches her in ways and she is unable to talk because if she does, he will fail her." But it's not all bad news. In Kazakhstan, and as part of a school and healthcare-based adolescent mental health awareness and suicide prevention program, we are seeing impressive results. This girl, Dina, is one of kids who was helped. In the new State of the World's Children report on mental health and well-being being launched, or that was just launched this month, we include new analysis by RTI International, an international nonprofit research institute that indicates that good school-based interventions that address anxiety, depression, and suicide provide a return on investment of 21.5 US dollars for every $1 invested over the life of the child. It's amazing. I think we often talk about, lost economic, value, but we don't talk about the gain in investment and the return on investment. And I think this needs to be more and more part of our narrative. And certainly, UNICEF plays a critical role in safeguarding mental health in a number of humanitarian settings, including for young refugees and migrants in Mexico and in Spain and in Beirut, where this 9-year-old Jad received psychosocial support after the blast last year. And at UNICEF, we are focused on addressing the ill treatment of children facing mental health crisis. Shackling and institutionalization remains widespread in some countries and communities. One of the contributions to our perspectives essays in our recently launched SOWC report on mental health is this young woman, Leah Labaki, who is now an activist for people with psychosocial disability. She was institutionalized at the age of 13. She writes in her essay, "There is no better way to promote mental health than to instill in the next generation the understanding that psychological distress is not deviant behavior to be repressed and hidden away, but just a normal aspect of human experience. Deinstitutionalization and community-based support will be key to achieving this." So what is UNICEF doing in practical terms in this space? Before getting into the details of UNICEF's work, I thought I'd introduce you to a term, mental health and psychosocial support, or MHPSS for short. This is a catch-all word for a range of services aimed at safeguarding or promoting mental health and psychosocial well-being, as well as preventing or treating mental health conditions. I wanted to bring this up because terminology can be a hindrance or a help. You probably hear mental health and psychosocial support used separately, but at UNICEF, and regardless of setting, humanitarian or development, we encourage the use of the composite term MHPSS to promote and safeguard the crossover nature of MHPSS within program design. Using this composite term recognizes the connection between programs that target the community level and focus on building resilience, developing community support, and activating community mechanisms, and the programs for whom community-wide activities are not adequate and for whom more specialized support is needed. Now back to what UNICEF is doing. UNICEF is a globally facing entity providing technical, mental health, and psychosocial support expertise across sectors and agencies. We supported the COVID-19 response with operational guidance for implementation and adaptation of mental health and psychosocial support activities for children, adolescents, and caregivers, thus filling a huge gap as it relates to this age group, to younger children and their caregivers. And of course, we're not working alone in this space. We are strong because we work very closely with our partners, others who are active in the space of mental health. Alongside the World Health Organization and other partners, we also prioritize the development and dissemination through an interagency body called the IASC MHPSS Reference Group, focusing on rapidly meeting urgent needs for accessible, easily adaptable resources and guidance for children and caregivers. These were more than I can count today, but mentioning a few here, including My Hero Is You, which is the book that is designed to help children cope with COVID-19 and the product of consultation with thousands of children, parents, and caregivers and teachers across 104 countries. Since its release, My Hero Is You has been translated into over 140 languages, including in Braille and sign language, and has taken many forms around the world, delivered through storytelling initiatives, virtual storytelling sessions, videos, radio, and on television. A Caring for Caregivers version was also developed shortly after, and we released a second version that focuses on parenting and return to school in September of this year. Another important resource was the Basic Psychosocial Skills Guide, aimed at building basic psychosocial skills among all essential workers responding to COVID-19. UNICEF also compiled a learning brief that pulls key learnings, examples, and evidence from the initial MHPSS response with a focus on children and families. Now, all the tools developed and guidance on what works were critical for UNICEF and partners working with children, and supported quality of interventions as well as our reach of the most vulnerable. In a simple snapshot of MHPSS services provided at UNICEF, the implications are mind-boggling. In 2020, UNICEF reached 47.2 million children, adolescents, and caregivers with community-based mental health and psychosocial services in 117 countries, an exponential growth compared to 4.7 million reached across 60 countries in 2019. But much more needs to be done. As we are all currently experiencing, there is an increased interest in mental health due to COVID-19. Forums that have never before recognized or addressed mental health are now seeing the need to support people through this crisis. Let us use this additional global spotlight on mental health and see it as an opportunity to increase the programming, research, and evidence base for mental health needs and care. Let us put forth some important priorities that we can harness and elevate collectively, particularly at this time of global need for children and caregivers. The recommendations I will present today are driven by UNICEF's State of the World Children Report on Mental Health and Wellbeing, launched on October 5th of this month. They build on key messages to break the silence, to call for investment, and to drive leadership and action. First, we must commit. There needs to be investment in mental health and psychosocial support services integrated within health, nutrition, education, child protection, and community support systems for children and families. We must communicate and so address stigma at all levels and change the public narrative around mental health and elevate voices and actions of service users. This includes youth and caregivers in order to really ensure meaningful a meaningful effort to change the dialogue so that it is not brought upon communities, but developed, a narrative that is developed with them and for them. And finally, we must act. There needs to be improved family-centered approaches to mental health and psychosocial care of children and adolescents through parenting support programs, promoting healthy family relationships and supporting caregiver well-being and mental health. There needs to be a more intentional focus on schools and communities to ensure that no child is isolated and that mental health services are available for children who need them. And we need to invest in a competent mental health workforce, specialists and non-specialists, to improve access to address varying mental health needs through health, education, and social protection services and other entry points for care. And lest we forget, we need to fill the data gap that helps inform our policies and strengthen research and evidence generation in this space to ensure quality of services and programming for our precious children and their caregivers. Drawing to a close, here is the big picture at UNICEF. Together with key partners such as WHO, we made mental health across development and humanitarian settings one of our top 5 global priorities for the next 5 years. And what does this look like? We are ramping up implementation, investments, research, and advocacy in mental health and psychosocial support globally. This will take shape through a very exciting development, many, in fact, over the next few years. First, we are incredibly happy to say that we will be ramping up programming and technical support to over 100 countries through a multi-sectoral MHPSS framework for action. Second, as I mentioned earlier, the State of the World's Children Report for 2021, UNICEF's annual report, launched earlier this month and focuses entirely on mental health and involves a roundup of the research, priority settings, and recommendations for children and caregiver mental health. Third, we are strengthening global partnerships, many global partnerships, including mental health and psychosocial well-being and development of children and adolescents as one of 4 strategic priority areas for the UNICEF-WHO Strategic Collaboration Framework, resulting in a 10-year joint program between UNICEF and WHO that is specific to child mental health. And finally, mental health has been named as a key advocacy priority, so you will be seeing many more advocacy efforts, messaging, and coordinated strategies on this in years to come. And through all of these efforts and priorities I've mentioned here today, UNICEF will need to be hand in hand with the global mental health community. And so we look forward to working together across nations and including here in the US to ensure that continued efforts to address the mental health and psychosocial well-being of children is based in the latest evidence of need, using the most effective interventions and provided by a workforce that is skilled, capable, and relevant. Thank you so much. I am honored to be with you.